It's a okay. It's a really pleasure to have you with us today for this webinar focusing on blood donation, a cause that continues to save countless lives every day. In Palestine, every day, some needs blood transfusion, whether it due surgery, accident, or complication due to cancer or anemia, or due injuries due to the Israel occupation. In spite of our good preparedness, we sometimes face a shortage, especially during emergency situation. So we need a constant supply of healthy voluntary donation to keep up with demand. Really, in the Ministry of Health, we are proud to be active involved in blood donation initiatives, working closely with communities, volunteer, and healthcare partners to make a lasting impact. We make a lot of activity to increase the number of blood donors and make them volunteer, but we stuck with many difficulties because we are in emergency situation continuously. Webinar like this one are a key part of our efforts, not just to arise awareness, but also to build knowledge, share experience, and grow together as a professional. We are especially honored to welcome our speakers, Dr. Mehtab and Dr. Damika, who brings a wealth of insights and dedication to this field. Our webinar today with the theme of voluntary blood donation and awareness. We will have two lectures. The first one for Dr. Mehtab. Dr. Mehtab, she's a vice president in High Institution for Education and Research in Transfusion Medicine in Iran. And she is also a chairperson for Voluntary Blood Donor Working Group for AATM. Today, Dr. Mehtab will talk about donor recruitment and role of social media. Dr. Mehtab, you are welcome. Dr. Mehtab.
I think there must be some technical challenge with Dr. Mehtab. Dr. Lena, can we start with Dr. Dhamika?
Yeah. Welcome, Dr. Damika, with us. Good evening. Dr. Damika, she's a consultant to
Dr. Mehtab has joined.
Yeah,
Dr.
yeah,
Mehtab
I'm
with us.
here. Yes,
Hello,
sorry.
Dr. Mehtab.
Hi, and good afternoon
No
and
problem.
good evening, everybody. It's my pleasure to be here today with our colleagues in Palestine Blood Services. And I'm very happy to discuss an important topic in transfusion medicine, voluntary donor recruitment and retention. May I have share my screen for my yes. Okay. Can you see my presentation?
Yeah, it's clear.
Yeah, it's visual. You can see.
Okay. You know that blood donation is a fundamental pillar of transfusion practice, ensuring that hospitals and medical facilities can provide transfusion. However, a sustainable voluntary non-remunerated blood donation system requires effective strategy to recruit, engage, and retain blood donors, particularly among the young generation. Today, I will I will start with a brief background and then cover a strategy to recruiting blood donors, importance of young donors, social media, and finally a conclusion. As a background, you know that in 1975, the 28th World Health Assembly called for development of national blood transfusion services based on voluntary blood donation. However, as you can see in the global WHO map, also nearly 50 years have passed. The goal of achieving 100 voluntary blood donation system has not yet fully realized in the world. However, significant progress has been made in some countries, in some regions, and today I'm to share my experience and research and study and practical strategies for donor recruitment. The first strategy and the main topic is for recruiting new donors is deep understanding the interests, attitudes, and behaviors of your target group.
Agenda එකක්ද මම ආරම්භ වෙබිනා එකේ ඉන්නේ මගේ ප්‍රසන්ටේෂන් එක පටන් ගන්න තමයි.
One of the most important of target group for blood transfusion services could be young generation. You know that young donors could be the backbone of any sustainable blood donation program because young individual meets the eligibility criteria for donation. They can be or long-term blood donors. You know that recruiting young donors improve the lifelong donation habits. Also, young generation are more receptive to educational initiative on health and social responsibility, blood donation, eligibility criteria, prevention from the risk factor, and something like that. Also, younger population have a higher likelihood of being cytomegalovirus negative, which is crucial for a specific patient, for example, neonate and so on. Also, encouraging young generation make more community engagement. So youth involvement is very matter for blood centers. And as a definition, as you know, in blood centers, 18 to 25 years old people considered as young donors. And as you can see at the global status report of World Blood Donor Day, youth contribute about 28% of blood supply in the world. No, the question is arise that how we can understand the attitude, the interest, and behavior of our target group, especially young ones. To understand our target group, we can use different ways. We should collect and analyze data using various methods, including different survey, interview. By survey and interview, we can gathering direct feedback from potential blood donors or from blood donors to understand their motivation, their concern, barrier to donation. And this method helps to identify key factors influencing donor behavior. The other method is focus group. Focus group provide an opportunity for us to engaging a discussion opportunity with selected participants to get a deeper insight from the perception and attitude toward blood donation of target group. Also, observation, online analytics and analyze feedbacks are other methods to understand our target group. And also, we should identify the common reason why people do to action or refuse to donate blood. For example, some people say us that I cannot donate blood because we believe that blood makes us weak, to be afraid of getting HIV, donating blood make us anemic or poor nutritional situation. This method, target group interview, survey help us to find a common reason why refuse to donate blood in different community. For example, the reason also is different in Palestine with the reason in Iran or other part of the world. So we need some survey to find this reason and plan to resolve it as much as possible. And after understanding the behavior and the common reason to donate blood or not to donate blood, the next step is raising awareness about the importance of blood donation for medical advancement and patient care. We should select appropriate channel, appropriate communication method that is different for each target group. For example, poster, leaflet, newspaper, and is a different method to raising awareness of our target group. Use of popular social media platform among the general population, such as Facebook, Instagram, Twitter, or local social media can be a good option and good choice for each blood service. And social media and partnership with social media is very important. And you know that social media play an important role in engaging young donors. Platforms such as Facebook, Twitter, TikTok, and social media have several benefits and risks that, no, I move past the topic considering the time, and no, let's explore some published evidence on the role of social media on donor recruitment. In an article that published in Germany in Transfusion Journal in 2018, yes, the results show that social media motivated more than 7% of donors among them, mainly young and female donors. And the result of this study showed that social media have become the second most important motivator to recruit new blood donors. And also, the results show that social media are becoming increasingly important for transfusion services. In another article promoting blood donation through social media, evidence from Brazil, India, and the USA, show that in the introduction of this study, we read that this study was designed to evaluate, to examine the effect of Facebook in the United States, also in Brazil and India, in partner with 4 of the largest blood donation organizations to track daily blood donation, visit before and after the rollout of the blood donation tools. And as you can see in the result of this study showed that Facebook blood donation tool increased blood donation in the United States by 4% and increased donation from first-time donors by 80.9%. And the findings show that this tool was specifically effective at recruiting first-time donors. And another initiative of social media and so on is a website named Face in Blood. You can search this Face in Blood in the internet. And in this website, they explore a religious perspective on blood donation. And this website have different sections. For example, Islam section, Christian section, Buddhist section. Every religious you can imagine has a specific section for them. And if you click on this section, for example, I explored the Islam section. A lot of fatwa and hadiths are gathered to motivate people to donate blood. For example, does blood donation have any reward? The response of different marja was gathered to respond to this question and motivate people to donate blood based on their religious beliefs. Other strategy, the next strategy to donor recruitment is maximizing the impact of World Blood Donor Day. You know that World Blood Donor Day is an essential event in the Global Transfusion Committee, serving as a powerful platform to raise awareness and encourage participation and recognizing the contribution of blood donors. And I reviewed the last year's report from Palestine Blood Service on World Blood Donor Day, and I know that impactful initiative was organized, and I hope this year will be Palestine will be as active with meaningful program ahead, and will share them with AATM Zoom platform. However, the World Blood Donor Day is a good opportunity to raise awareness in the community and get support from the government, NGO, and community. And the next strategy I would like to discuss about that is Donor Recruits Donor Program. The Donor Recruits Donor Program, in this program, regular donors are encouraged to spread awareness about the importance of blood donation, need of blood donation in the community with their social circle, for example, for their friends, family, colleagues, and community. And the aim of this program is empowering existing donors to actively recruit new donors. And in some countries, in this program, offer incentive, for example, recognition, certificate to donors who bring in new donors. And in a article was published by Netherlands Blood Services, they report that donor recruit donor program was the most powerful method to recruit new donors. As you can see, more than 40% of new donors come to blood centers by donor recruits donor program. And I think it's a good idea for countries that use from these techniques. As in conclusion, I would like to say that the youth donors, young generation, as a very precious resources to saving lives. Also, donor recruitment strategy relies on evidence-based strategy. Donor recruitment is a professional job, and donor recruiters needs very specific information and learning and training. And these evidence-based strategy are informed by research, data analysis, and best practices. Also, social media and technology are becoming increasingly important for transfusion services. Also, finally, I would like to say that reaching to 100% voluntary blood donation is a gradual process. Is not achieved over one night, and it needs to a lot of activity over time to build a sustainable blood supply. Thank you.
Thank you, Dr. Mehta, for your informative information on this lecture. And I'm very happy to see and thank you very much for the testimony of our annual report of Blood Donor Donation Day. We really, in the Ministry of Health, try to do a big activity to share our ideas and to share the importance of blood donation for our community. But we still stuck with much of difficulties, but we will try. We will not stay on any stage. We will try and we will be for in our strategies. We will go ahead and our strategies to be 100% on involuntary blood donation. In Palestine, we still have 65% voluntary blood donation as a percentage. But we still we will still depend on family replacement for donation due to our complication faced on Palestine. Thank you very much for your lecture.
Welcome. And Dr. Lina, I think more than 60% of voluntary blood donation for Palestine blood centers that I know that you face with a continuous crisis is very good. Very good.
Thank you. Thank you, Dr. Mehtab. Okay. Now let's start with with the second lecture with Dr. Damika. Dr. Damika from Sri Lanka. Welcome. Dr. Damika, she's a consultant transfusion physician in a regional blood center. And she is also held a key leadership roles as a chairperson of the Sri Lanka chapter of the AATM and a secretary general of the Asian AATM. Welcome, Dr. Damika, and you can start.
Yeah. Good evening to you all. Thank you, AATM Group, as well as the Lina and the Palestinian Blood Service, and my friend, Dr. Mata. Actually, my topic is strategies for retention of the safe blood donors. Before I begin the presentation, I think, can you hear me? It's audible?
Yes.
Yeah.
Great.
Okay. Right.
Yes.
Yeah, we have so heavy thunder showers. That's why I am asking. Okay, anyway. And then I would like to highlight the vital roles, why donor retention play a sustainability of any blood services, why we are talking about the retention of blood donors. But Dr. Matab talking about the recruitment of the donors, and then we have to have some strategies to keep the donors in regular basis to get their donation. So while recruiting, that new donors are very also important. That retaining existing one is what is the main key donors to ensure the stable and safe and cost-effective blood supply. So I think for the Palestinian Blood Service, the donor retention is very, very important. It's a key priority to maintaining their committed donor base in the essential for the stable and reliable blood supply with their the problems at the beginning, at present. So today my presentation will focus on the why donor retention matters and what are the challenges we face while we are doing the before implementing the strategies for donor retention. Then I talk about the practical strategies to keep our donors engaged with the donation and coming back for the regular basis blood donation. Why we talk about why it is matters? The safe donors are critical for the safe blood supply. If the donors are coming regular basis every 4 months for the blood donation, it should mean that we have safe blood supply to the recipient. In our the recruiting new donors cost more costly than the retaining the existing ones. And then the repeat donors they are more reliable. They know what we are going donation process. They are very friendly with our staff, and they are more reliable and then friendly, and then giving the they feel that they want to donate every 4 months, and then they wouldn't get some risk behaviors, and then they have fewer health risk. And also from our side, from the blood services, blood bankers, that it is very important for to maintaining the better inventory management with a regular basis blood donation. And then it also build a trust and creating a culture for voluntary donation in the for the community, and also retention build a stable and responsive donor base, especially in the emergency and the high blood supply demand. Yeah. We talk about our National Blood Transfusion Service, Sri Lanka. We have 100% voluntary donor base since 2014 up to now. That we ensuring us for the safe blood supply. Always safe blood supply, as I told earlier, begins with the selected safe donors. We have to keep select the safe donor population. And then with the challenges of donor retention, we can identify the challenges. We can, what is it called, that implementing the strategies. And ultimate goal, we build a loyal trust and motivation among our safe blood donors. According to the WHO, they identified some essentials for the donor retention. One is the low risk population. They talk about the low risk population to identify. It is very important. So that is encouraging the replacement donors. That I think your blood service, I go through the Google. And then you have different type of donors, family donors, replacement donors, paid donors. I don't know paid donors is, I'm not sure. And then the voluntary donation. So affecting identifying the low risk donor population, that encouraging the replacement donors to become regular, voluntary, unremunerated donor population. And then also they might get the promoting the self-exclusion as well as the self-deferral of unsuitable donors. And then other one is important one is the essential is the developing the effective donor awareness programs, that be effective donor awareness, education and motivation of the recruitment campaigns to encourage the people to give blood regularly, and then they know the benefits for the community, and then also ensuring the efficient organization of blood collection sessions in fixed and donor mobile campaigns, and maintaining the professional. We maintain the professional and efficient approach to the donor screening and the selections to ensure the safety of the donors and the recipient of the donated blood. And then also that we should provide, we must provide them to provide the high standard of care at the time of donation process, and maintaining their confidentiality always at all the time, so that donor trust on the service, and then people work on it and they trust, and the regular basis they are coming, that we should always keep the confidentiality of all the donors. And then also for the appropriate follow-up for them, showing their special contribution in the healthcare system, healthcare in the community. And then we should always maintain in the accurate donor record. I will discuss later in details. And then other last essential they recommended by the WHO is the follow-up of the lapsed donors. And then we talk about the challenges when we are doing the donor retention. the lack of awareness and the education of the regular donations. Here, many donors are fully aware of the ongoing need of regular blood donations. But first-time donors may not understand the importance of becoming the repeat donors. So we have to motivate them to do the regular donations by the donor retentions. And sometimes donor might get negative donation experiences, like once they come to the donation, if they get the negative experience, they are reluctant to come in the next time. So we have to be very careful about the to avoid the negative donor experiences, like painful or uncomfortable experiences during the donation, like difficult VD puncture, that we train our staff for the well trained for the phlebotomy. And then the fainting attacks, sometimes that we can overcome by we can aware them about how to prepare for the preparation for the donations, having a good meal and according to the standards that we advise them in the awareness programs. And then we can avoid them for the negative experiences. And sometimes that long waiting time, they are way in our system. They are not like to wait for a long time. They are not coming back again to us. So we do our best to keep them the donation as early as possible, and then to complete the donation process as early. Long waiting time and poor services also at the donation site also contributing for the negative donor experiences. And then the inconvenience, and then the inconvenient location and the timing. Sometimes that donors are coming in the odd time. So we explain them what period of time that we are open for the donations, especially in the in-house donations. And then the health-related deferrals, that either might be a temporal deferrals or permanent deferrals. In the temporal deferrals, we should have a records how long that patient, a donor might defer. And then at the time, we should have a donor base, donor records that will help to restrain to the donor after deferral temporal deferral period is over. And then the lack of personal collection. Lack of personal collection, and then sometimes donors are fear for the donation and needle wearing, and then the anxiety for the donation. So we have to avoid those negative experiences, challenges by giving them the proper awareness programs during the donation. And then no regular follow-up or communication. This is most of the time that most of the blood services that we don't have no regular follow-up or communication with the donor. We can't communicate with closely with them, personalized communications, and we are not coming. And then limited incentives. Those also, I think Dr. Matab also talk about this incentives for that. And then we talk about what are the steps for developing a successful acquisition and the retention plan. What we have to do, and then the retention plan. We have to consider the following steps to develop the successful donor acquisition and the retention strategy for your organization. You, at the beginning, before you want to do the retention strategic plan, you have to examine, analyze your situation and analysis, your trends. And then the trends, who are the donors that are coming for the age-wise, female or male, and what are the most deferral criteria, what are they have, negative that feedback from the donors, and then you examine their trends, and then assess your organization data and the trends that will help to plan your strategies. And then what segment your audience, who are the people, age group people you are coming, that with the general generation, with the different generation is then the addressing the donors is different. For the older generation, that the communication methods are different. And then the young generation is Z generation is that different like that. So they are more engaged with the social media. So through them that we have to address them. That our donors who are in the elderly population, it is different criteria we should use to motivate them for the retention. And then strategically budget also for the success that we have to think. All these steps should be keep it simple. Donor acquisition and retention strategies, as I said, differ by the generation. How to assess your organization data and trends. What was your acquisition and retention rate strategy during the last 5 years? With your records that you analyze, how the movements of the donor retention. And then also, you had to think about the economic and political and social changes, as well as the COVID-19 pandemic, how to affect this trajectory for the donation trends. And then also what channels of communication have been most effective to reach your target audience. As I said, in the generation wise, that their target audience are different, that we have to address with each different audience. Different method. In our blood transfusion service, we introduced a web-based data management system that online database maintained, updated by the national blood bank staff. They analyze the donor details there, and the donor deferrals, re-entry of deferred donors, and the sending the invitation for the eligible donors on time. That we through by the SMS system. Short message services also introduced to motivate the regular donors to involve in for the donations and promote their retention. These are the overviews of key strategies for the donor retentions. Excellent donor experience. Recognition, I will discuss later in detail later. And recognition and rewards, personalized communications, health benefits assurance, engagement, and the education. When the excellent donor experience, the donation process should be quick and efficient. It should be in the comfortable environment. In National Blood Transfusion Service, our 85% of the blood donation camp, blood collected from the mobile camps, 15% of collection in the in-house. Every blood that our national service that interconnected 108 blood services in the country with the BBMS system. So donor registered with identity card number, and then all the donor details from donor recruitment, donor registration, and the donation process, and post-donation adverse effects, all we interconnected with all the blood banks with the centrally coordinated system. And then we have a uniform protocols to applying for all the country over the country with the similar manner, comfortable environment. And then that we are the organizers. In my center, around 25,000 blood collected per year average. That we do every month. We do at next month donor organizer meeting, awareness programs. And then we call them and then sit together and discuss what are the bad experience they had in the last time, and they get their feedback, and they aware them what is the importance of safety and the quality. And main two goals in the transfusion service: safety of the blood and the donor, and as well as the quality of the product. That we explain them, and which give them to opportunity to see how blood is collected, what happened to the blood once we received to the blood bank, and the donation blood component laboratory, TTI laboratory that we give them to show, see the things that they, we talk with them the real stories about the recipients and the donors, and then sharing with them a very friendly manner in every month in the every blood banks in the collection centers. And then also recognition is very, very important, and their appreciation for their the donation. We send them the thank you messages, the immediate and personal messages, and then with the awarding that is during the special milestone of their day donation, 5th donation, 10th donation, 25th donations, we give some certificates and then some not valuable presents. That is something that some incentives that we are given them to for their appreciation of their donation process. And then also we do World Blood Donor Day celebration, and then selecting the donors, the regular donors with the different criteria that we use to collect do the felicitation programs in every blood banks with the national event in the Colombo, our National Blood Center, during the World Blood Donor Day in the June 14. And then also that we give them the public recognition with the special occasions that we use to give them the certificates, and then social media shout outs, and then we share their donation, that their special milestones, and then we share with the Facebook pages, and then our social media that we use to appreciation and the recognition at the public. And then through the social media, as I said, that we share their certificates, donor videos, create the donor spotlights and thanking messages. These are some plaques that we prepare for them to give their special milestone of the donations. These are some pictures in the last 2024, our blood donation, the World Blood Donor Day celebration. This is the crowd that in the 1,500 donors are felicitated with the organizers. Yeah, in the personalized communications, very important to retention of the donors. How we do that? We are sending the, we have the separate each blood banks that we, collection centers that we have separate internet and the communication facilities. And then we send the reminding calls, text messages, emails for their next eligible donations for the through the donor portal. And then also that we request them to come and celebrate their special events in the life, like birthday celebrations, anniversary wishes also we send. And then we prepare the photo shoot place for them to celebrate their the birthday, special wedding anniversaries, and the special events their life. We prepare the places. I don't have some pictures that we have. I couldn't put it there. That is also very important that we with them that we call them, and with them that we are do the celebration, sharing their happiness. And then and at the same time that we update on how their donation help to the recipient. And then also at every donation camps that we get the survey to get the donor feedback and the suggestions. So every blood banks that we keep the suggestion box to upgrade our services. Some bad experiences they had, that I keep the box there. They do their some complaints, and through also our email system is there that they send the feedback on their blood donation experiences and some suggestions for us. Donor portal is an online platform for the managing the blood donations. This is using portal offer many benefits for all organization as well as for the donors to improve the blood donation and encourage the people to donate more frequently. Also, that donor portal help to manage the relationships and make the things easier for everyone that involved in the donation process. And we also donor retention, we emphasize them. It is promoting their health benefits. And then every donation, we can do the free health checkup at the donation because the donors are in our system. Donors are counseling by the qualified, the trained doctors, not the other staff. All the doctors that involved in the blood bank, medical officers who are involving in the donation, counseling, and then health checkup. And then the advice, health advices we can give, and then education, especially in the anemic patient, and then we give follow up them and giving the iron tablets, and then again that we ask to review in the 1 month time, like that we according to our protocols that we educate and then give the health advices. And assurance of donor health protection during and after the blood donation, we assure them and addressing there some myths and concerns regarding the blood donations. That also that be very important to retain the donors. And then the donor engagement and education. So that additional involvement of the donors to our dedicated donors can become ambassadors and advocate them to your work, and then ask them to then actually from our the My Center, if we organize the event in the blood center, our regular basis that very friendly donors that we have some groups that we involve them, or organizers, not only donors, organizers, mobile camp organizers, we invite them to involve with us. Sometimes that we use the regular donors for the awareness programs. They are sharing their experiences and then how they feel after the donation. And with the awareness programs, they will let them to talk about their experiences. And then this is the sharing, the inspiring the donor and the recipient stories, and regular newsletters, updates like donor exclusion contents that we educate with the donor retention. Innovative approaches that we use some by the badges and the mobile apps, and peer-to-peer donor recruitment incentives that we use, mobile donation units for easy access, and then the flexible donation hours that open for the morning 8 AM to evening 6 PM. Our blood banks open for the blood donation, but in case the donor came in the night time before 8 PM, that we allow them to, very rarely that we got they receive the donors, but we allow them to for the donation. No hard and fast rule, but our center they have a hard and fast rule for after 6 PM they are not registered the donor, but in my centers that sometimes donors are coming in late in the after 6 PM that we allow them to donate, do their donations. Like that we flexible with their comfortability. And then the monitoring and evaluation, very important. You have to keep the donor records in the digital platform or maintain the registries, track donor return rates, and analyze the recent dropout, and then the donor satisfaction surveys from the mobile donations and the in-house donations. This is how we get their feedback about their donation, how they feel that. Accordingly, that we are sometime that they donor feel the negative feeling, and then we address them, and then from our side that there's a fault that we talk to the relevant staff, and then we do the correction, and then adjust strategies based on the feedback. In the conclusion, if we have a proper donor base, retention donor base, that it's also partnership with the donors. Safe donors are the backbone of our strong, safe blood supply in the blood services. Our commitment, safe, caring, and with rewarding experience for every donors in all ways. Thank you. I think you can
Thank you.
understand that how we are, these are all our experiences. Now 75% of donors, donor retention rate is 75%. They are coming every 4 months or 6 months, once a year, depending on their wish for their blood donation. Most of the donors, we have 75% of them are regular donors. Yes.
Yes, thank you, Dr. Damika, and heartfelt thank you for your presentation, inspiring and informative session. You give us a valuable knowledge and motivate us to continue this work, this important work. But really, in Palestine, we try most of these strategies to make a donor as voluntary. But we stuck with some difficulties. I don't know how we can point these difficulties. And I want our colleagues, thank you, our colleagues, for your participation. If anyone has have a question for our speakers, and if anyone have an idea to say.
While we wait for the questions, I would request Dr. Navjyoti Chaudhary, President, Asian Association of Transfusion Medicine, to say a few words.
Thank you, Dr. Ikas. Just give me a few moments. I have actually just parked my car, and just give me 2 seconds. I'm adjusting my video, and I'm actually very happy to see the progress as well as meeting today, and two knowledgeable speaker. They have they have spoken very nicely. I have actually attended both this lecture, and and these are the two countries which actually have done excellent job having 100% voluntary blood donation as well as repeat voluntary blood donation. I have visited both the countries, and what we have seen that in Sri Lanka, actually, that the transformation of Sri Lanka is just in front of my eyes. The first time I visited Sri Lanka in the uh, can you hear me? Am I audible? Because I am from a handset. Dr. Ikas, can you hear me?
Yes, Dr. Chaudhary,
Yes.
it's clear.
Okay.
Okay. I visited Sri Lanka in 1999, and that is the first year I saw the blood center was in a part of a hospital, and I have seen the transformation. They got a Japanese grant, JICA grant. One of the resource person was staying, and the transformation of the voluntary donations. So I mean, it is last almost 22, 24 years, and totally transformed the transfusion services. I have also visited Iran probably 4 times, and all times this is new experience. Again, they have done a very good job. Again, 100% donations, and probably, if I'm not wrong, please correct me, Dr. Mehtab, is almost 85% repeat voluntary blood donors, something like that. So these are the jewel in the crown of AATM member countries for voluntary donation. And two top speaker has already spoken to you. My only last word to my our members from Palestine: see, if our colleague can do, why not us? We can also do that. It needs a strategy. It needs continuous working. And I'm sure someday we'll achieve it. Having said that, a big country like India, we also do not have 100% voluntary donation. We don't have. Our actual voluntary donation is almost, you can say 70%, 60 to 70, 65, 70%. Rest is maybe still family replacement donation. We are also struggling with it. So it is a continuous struggle for all of us to make the blood safe and sound and vein to vein safe blood transfusion. And I'm sure this today's both the lectures will give a good impact in the voluntary donation. Before I stop, I thank both this speaker as well as Dr. Leena for spreading this information about this webinar. But I will again feel my duty if I do not thank Dr. Aikas. He is the backbone of all AATM scientific programs, including webinars. And we know how hard he is working almost every day. Thank you, Dr. Aikas, Dr. Leena, then Dr. Dhamika and Dr. Mehta. Over to you. Thank you.
Thank you, sir, for your kind words. I would request Dr. Leena to conclude.
Thank you,
the
Dr.
If there are no further questions, we would like to bring this webinar to an end. No, wait. There is a question in the chat box by Abid Zatari. I would request Abid Zatari to please ask your question directly. Both the speakers are there. Please unmute yourself and ask the question.
Hello, everyone, and thank you for your webinar. I want to ask how we can apply donor satisfaction service. Is there a special form? What kind of question could we ask them?
I couldn't hear the questions very clear.
Hello. That's a good question. Thank you. As I understand, you ask about the satisfaction survey among blood donors. That's right?
Yes.
Yeah. That's a good question because the direct feedback from the blood donors are the backbone of everything we do in the blood centers. These questionnaires have different parts. Some part about the behavior of a staff with them. The next part about the refreshment and the time that wait in the queue to donate blood and something like that. If you are interested in the standard satisfaction questionnaire, I can translate or satisfaction survey of our blood donors and send an email to Lina. Okay?
Yes, thank you.
Yeah. Yes. Next week I try to translate and send over Lina.
Yeah, actually, from our blood service, that in the donation process, different type of staffs are involving in the recruitment officers, nursing officers, and the doctors. So each sections that we are putting the how the staff will treat the patient, treat the donor. They are satisfied or not with the emojis that we introduce that depending on their feelings that we emojis that introducing, and then also that we ask about their available facilities for the comfortable environment, and then the water, electricity, and the fan in the cool environment, like that is a cleanliness, and then they comfortable with the place, like that. There are some questions that we is about, I think 10 questions are there. That then according to the emojis that they give their response. And then it is actually we don't want to their names. But in the special inquiry, in special issues that they face during the donation time only, that they can communicate with us directly with me as an in charge, and also with the email portal. Otherwise, for the donation process, that they take their feedback by the that form. That's all.
Thank you, Dr. Damika. And we can make this form like a questionnaire for each donor to ask them if they are satisfied to our for our centers or not.
Yeah.
And the form has have many questions. Yeah.
80,
Okay.
80
Thank you.
question, I think.
What, Abed?
I think they talk about 80 questions about comfortable of the donor, electricity, about AC.
Yeah.
Yeah.
All of these should
This
have
is
on the
also
same form. Okay.
involving. Yeah. And then it's a problem, but most of in our country, almost all that can read and write.
Yeah. Yes. Yes. Thank you, Dr. Damika. Thank you, Dr. Aikis, also for a good preparedness for this webinar. Dr. Aikis with us? Okay. Thank you again, Dr. Mahtab, Dr. Damika, for your informative lectures. We are happy with being with us today. Thank you, my colleagues who joined us today. Your participation shows a shared commitment to save a life and making a difference. Thank you very much for your good preparedness.
Thank you.
Thank you, Dr. Lina, for organizing this webinar. Also, Dr. Aikach, Dr. Chaudhary, and Dr. Danica for participation, and all participants from Palestine Blood Center. I hope we have a good news about the achievement and advancement in blood donor management from Palestine Blood Services. Thank you.
Inshallah. Thank you.
Okay.
Okay.